Harmed, bereaved, their complaints ignored, their fears dismissed. Today, though, they were heard.
You came to us with the most painful accounts of your lives. You allowed us into your grief. I hope that this report, however hard it is to hold, tells you that you were heard.
And the chair of the 3-year-long review into maternity services at Nottingham University Hospitals NHS Trust summed it up like this.
This report is about what happens when leadership fails, when governance fails, when a culture develops in which bullying is tolerated, concerns are suppressed, incidents are downgraded, and the voices of women, particularly the most vulnerable women, are systematically dismissed.
More than 2,500 families came forward, and the majority of cases are between 2012 and 2025, but some do go back to 2006. Of the cases they reviewed, 520 mothers and babies were potentially harmed or died. Better care may have prevented, they said, 94 stillbirths, 62 neonatal deaths, and 6 maternal deaths. In 2021, Channel 4 News and The Independent revealed the scandal of Nottingham's maternity units. An investigation was ordered, which eventually became the Ockenden Review. At the time, we met the Needhams, whose baby Cooper had died at home just 1 day old.
I sat up and I put my hand on his chest and there was nothing.
His family had repeatedly raised concerns about his colour and poor feeding and were repeatedly dismissed by midwives. After his death, they were even questioned by police, and so shockingly, they were mistakenly sent the autopsy pictures of their baby.
So originally we was told that it was a whistleblower that had sent them. So I spent 4 years going through the paperwork and looking at the images to try and figure out what a whistleblower would be trying to tell me. And we then found out after the 4 years that they sent it in error and they just didn't want to admit it.
And you said that's the last image you've got now.
Yeah, the last image obviously is a lot of the other families. Their last image is them holding their baby or a photo of their baby in their first outfit, and mine is of my son on a mortuary slab.
And yet the family was only sent what they describe as a generic apology.
This is, of course, a trust at the heart of the city, and there were those who worked there, like Sarah and Jack Hawkins, whose baby Harriet died. And then they read the review and they find out that the warnings were there for years, and that there were staff who tried to speak up but who were actively discouraged. And finally, they learn that half of the senior leadership team did not give evidence to Donna Ockenden's review.
There was unkindness, even cruelty. Women in the middle of labour told to pull themselves together. Staff described racism and racist attitudes towards black women, labelled too loud and too demanding. The review even talks about mortuary services. Jack and Sarah Hawkins' baby, Harriet's body, had been allowed to decompose. 2 men have now been arrested.
I want to make sure that change happens. So I'll be setting out today our next steps around Martha's Rule being rolled out across the country, around the duty of candour to compel NHS staff in the future to give evidence to any inquiries about maternity services, and to check the last 10 years' worth of records in mortuary services across the country.
Anthony May became chief executive in 2022, just as the Ockenden Review began.
Families have consistently said they don't want an apology until you know what you're apologising for, and yet you have just apologised.
Yes, that's right. So I've agreed with the families that it's okay to apologise for the failings and the harm that the trust has caused, because that's not disputed. What the families want is for us to work with them on a fuller and more meaningful apology which reflects the detail and the content of Donna's findings.
There were tears today and relief, and a minute's silence in tribute to those who had lost and who had been harmed, and a pledge from Donna Ockenden herself that she will not allow this report to be forgotten.
And Victoria Macdonald joins us now from Nottingham. Victoria.
Yes, well, you heard there Donna's very strong words, but she has also said, of course, there have been some improvements at the Trust, yet she wants there to be some essential actions, and that includes listening better to mothers and families, better staffing, making sure there's more training. And to this end, there will be a board set up, a sort of a task force to ensure that this all happens, that it doesn't get forgotten, and that will include some of the families. Now, the families today have also said that they do want a statutory maternity inquiry, which means that people will be compelled to give evidence, because you heard there in my film, some people did not come and give evidence to the review. They also want more scrutiny of the regulators, the General Medical Council, the Nursing and Midwifery Council and the Care Quality Commission, because again, the family said they weren't always listened to when they made complaints to the regulators. The regulators themselves have said sorry and said that they have now engaged more. Donna Ockenden led the Shrewsbury and Telford review. That was 4 years ago. Today, she said, almost none of the recommendations were implemented from that review. She is determined that it will not happen this time.
Thanks, Victoria. Kieran.
Well, a short time ago, I spoke to Donna Ockenden, who, as you've been hearing, led that review. And I asked her how dark a day this is in the history of the NHS.
Our findings are deeply distressing, a long-term history of women, families and their own staff not being listened to, women being denied caesarean births when they were begging for them and they clearly needed them, women being left at home to languish in labour for days at a time and not being believed, often with tragic outcomes. And then finally, I think what I would say is that so many staff left that unit utterly broken by the pressures under which they had to work over a sustained period of time.
The Morecambe Bay maternity scandal, the report into that was over a decade ago. So you've got people in Nottingham going into work in the NHS. They'll have known all about those failings. So how on earth did they repeat them?
So I think that's a very good question, but I think we have to ask ourselves, who knew what? I'm really clear that the previous boards in Nottingham knew what was going on. This was about a culture where neither local women, local families, or indeed their own staff were listened to, and that is deeply shameful.
I was listening to what Jack and Sarah Hawkins were saying earlier, whose baby Harriet was stillborn, and effectively they were saying, if this happened in any other walk of life, if mothers and babies were harmed in this way, there would be uproar. And yet some of the people involved in this go to work in the NHS the next day as if nothing has happened. How do we put a stop to that culture?
I think that we've known for very many years what government needs to do to improve upon the safety of maternity services. And I need to be really clear here. My team and I do not make recommendations. We state very clearly what needs to happen in the here and now. And quite now, we do not have the luxury of time on our hands.
What I hear from the families is they are screaming for accountability. So they see senior leaders and maybe clinicians too who are still working in the NHS, even though they believe they're unfit to care for mothers and babies.
I can recall one senior midwife telling my team, on day one, she was told by an obstetrician and other senior midwives, "We'll soon break you, you know." And they did, and she ended up leaving. We have to accept that unless urgent action is taken, we are expecting those doctors, midwives and nurses to go into our perinatal care settings and deliver care with one hand tied behind their backs.
Did several, maybe even half of the senior leaders in Nottingham refuse to give evidence to you?
Yes. Now, taking that into account, I'm really, really pleased that MPs across Nottingham, Sussex and Leeds have very quickly, on a cross-party basis, joined together, worked together, and we now have a solution for Leeds and Sussex to stop that happening again. But I think the question we have to ask is there anything else we can do about Nottingham? The report is published, but should we be looking at, can we do something to compel those people who decline to cooperate actually to come back to Nottingham and cooperate in, you know, a piece of work?
I mean, this is obviously not the first scandal. It seems to be a national problem. Is it still happening? Are these failings still present in maternity services in the UK today?
Well, to some degree, they must be. So what I would stress is we know what we need to do to improve perinatal care. I did hear Secretary of State say that he's tasked the NHS with an action plan by the end of the year. But my concern is it is only June. We have 6 months to go until the end of the year. And already today, I've heard from families who've said to me, but how much more harm is going to happen while government is developing an action plan over the next 6 months? And I've actually had obstetricians, midwives and neonatologists say to me today, do you know, I'm not actually sure I'm going to be here in 6 months. Time is of the essence. We need to act.
Donna Ockenden, thank you so much for your time.
Thank you.
Well, Sir Jeremy Hunt was the Health Secretary from 2012 to 2018. I asked him why he thinks the NHS has not been able to learn from its mistakes.
Because it is the largest and most bureaucratic healthcare organisation in the world, and time after time, successive health secretaries, including me, have tried to solve these problems with central directions and instructions from the Department of Health or NHS England. And when you've got 1.5 million people, it just doesn't work. And I think in this case, you know, with the tragedy, these utterly stomach-churning stories that we heard today about what happened at NUH, I mean, the real issue is clinical accountability. I think that if a mum, when she found out that she was pregnant, was told, this is the small team of people who's going to be responsible for the safe birth of your child, including a doctor, a midwife, or maybe a couple of midwives, and we're going to be with you all the way through during the birth and afterwards, then I think people would know who was responsible, who they should talk to. A lot of these communication problems would go away.
I mean, wouldn't hospital managers say, we are not resourced to do that, in part thanks to years of austerity and tight budgets?
Over the last 15 years, the number of midwives has gone up by 17%. And because the birth rate has fallen, the number of midwives per birth has actually gone up by nearly 40%. And, you know, we have seen an improvement. We're seeing about 2 fewer babies dying every day in the NHS. So there has been improvement.
But in the overwhelming number of cases, the staff themselves said staffing was an issue. I think in sort of 9 out of 10 of the cases.
They did, but look at the numbers. The number of midwives has actually gone up, and gone up very significantly. And so that's why I think something else is going wrong here, which is that we've got a system that's very depersonalised. And the way to stop parents having these tragedies, they also say time after time they felt they weren't listened to. They didn't know who to go to when they thought something was wrong. When there was a problem, it wasn't escalated fast enough. And I think that the key issue here is to know who's the doctor, who's the midwife, who's actually in charge of making sure that my baby is born safely. And that's, you know, because you're trying to minimise risk, that's not something you can decide on the day of the birth. It's something that needs to be done, you know, several months in advance, so that you can identify who the higher risk cases are.
We seem to be in a terrible situation now where it seems to be only Donna Ockenden who can make hospitals safe again. You know, that she's got to now continue working with Nottingham to try and get their systems right. And if you're, you know, what you're saying about the NHS being a vast bureaucracy and a huge, and a huge system, other hospitals are not able to learn from that by themselves. It means that there are women today whose babies are at risk of the same thing.
I'm worried the NHS has become the world champion at producing reports into problems like maternity safety and other things that go wrong like mid-staffs, but also a world champion at not making the changes necessary so these tragedies aren't repeated. And so Donna Ockenden has done a very, very thorough report, and I absolutely commend her for that. But we need to ask why it is that I commissioned her to do the Shrewsbury and Telford report. I commissioned Bill Kirkup to look into the problems at East Kent. And, here we are, more and more reports happening, but, change isn't happening fast enough on the ground.
So Jeremy Hunt, thank you very much.
Thanks, Krish.